Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 practice NCLEX questions. Without delay, let's get started.
A client undergoes surgery to repair lung injuries. Post-operative prescriptions include the transfusion of 1 unit of packed red blood cells at a rate of 60 milliliters per hour. How long will this transfusion take to infuse? 1. 2 hours. 2. 4 hours. 3. 6 hours. 4. 8 hours. The correct answer is 2. 1 unit of packed red blood cells is about 250 milliliters. If the blood is delivered at a rate of 60 milliliters per hour, it will take about 4 hours to infuse the entire unit. The transfusion of a single unit of packed red blood cells should not exceed 4 hours to prevent the growth of bacteria and minimize the risk of septicemia. Which of the following findings would suggest pneumothorax in a trauma victim? 1. Pronounced crackles. 2. Inspiratory wheezing. 3. Dullness on percussion. 4. Absent breath sounds. The correct answer is 4. Pneumothorax means that the lung has collapsed and is not functioning. The nurse will hear no sounds of air movement on auscultation. Movement of air through mucus produces crackles. Wheezing occurs when airways become obstructed. Dullness on percussion indicates increased density of lung tissue, usually caused by accumulation of fluid. A client with rib fractures and a pneumothorax has a chest tube inserted that is connected to a water seal chest tube drainage system. The nurse notes that the fluid in the water seal column is fluctuating with each breath that the client takes. What is the significance of this fluctuation? 1. An obstruction is present in the chest tube. 2. The client is developing subcutaneous emphysema. 3. The chest tube system is functioning properly. 4. There's a leak in the chest tube system. The correct answer is 3. Fluctuation of fluid in the water seal column with respirations indicates that the system is functioning properly. If an obstruction were present in the chest tube, fluid fluctuation would be absent. Subcutaneous emphysema occurs when air pockets can be palpated beneath the client's skin around the chest tube insertion site. A leak in the system is indicated when continuous bubbling occurs in the water seal column. A nurse is to administer 10 milligrams of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 15 milligrams per milliliter. How many milliliters should the nurse administer? Round to 1 decimal point. Blank ml. The correct answer is 0.7 milliliters. The formula is 10 milligrams over x ml multiplied by 15 milligrams over 1 milliliter. You cross multiply, and you get 15x equal to 10. You divide by 15 on both sides. X equal to 0.666, and then you round to 0.7 milliliters. The nurse is preparing to assist with the removal of a chest tube. Which of the following is appropriate at the site from which the chest tube is removed? 1. Adhesive strip. 2. Petroleum gauze. 3. 4x4 gauze with antibiotic ointment. 4. No dressing is necessary. The correct answer is 2. Gauze saturated with petroleum is placed over the site to make an airtight seal to prevent air leakage during the healing process. Dressings with antibiotic ointment or adhesives are not used. A client who underwent lobectomy and has a water-sealed chest drainage system is breathing with a little more effort and at a faster rate than 1 hour ago. The client's pulse rate is also increased. The nurse should 1. Check the tubing to ensure that the client is not lying on it or kinking it. 2. Increase the suction. 3. Lower the drainage bottles 2 to 3 feet below the level of the client's chest. 4. Ensure that the chest tube has 2 clamps on it to prevent air leaks. The correct answer is 1. In this case, there may be some obstruction to the flow of air and fluid out of the pleural space, causing air and fluid to collect and build up pressure. This prevents the remaining lung from re-expanding and can cause a mediastinal shift to the opposite side. The nurse's first response is to assess the tubing for kinks or obstruction. Increasing the suction is not done without a physician's prescription. The normal position of the drainage bottles is 2 to 3 feet below chest level. Clamping the tubes obstruct the flow of air and fluid out of the pleural space and should not be done. A client has a chest tube attached to a water seal drainage system, and the nurse notes that the fluid in the chest tube and in the water seal column has stopped fluctuating. The nurse should determine that 1. The lung has fully expanded. 2. The lung has collapsed. 3. The chest tube is in the pleural space. 4. The mediastinal space has decreased. The correct answer is 1. Cessation of fluid fluctuation in the tubing can mean one of several things. The lung has fully expanded and negative intrapleural pressure has been reestablished. The chest tube is occluded, or the chest tube is not in the pleural space. Fluid fluctuation occurs because, during inspiration, intrapleural pressure exceeds the negative pressure generated in the water seal system. Therefore, drainage moves toward the client. During expiration, the pleural pressure exceeds that generated in the water seal system, and fluid moves away from the client. When the lung is collapsed or the chest tube is in the pleural space, fluid fluctuation is likely to be noted. The chest tube is not inserted in the mediastinal space. Which of the following rehabilitative measures should the nurse teach the client who has undergone chest surgery to prevent shoulder ankylosis? 1. Turn from side to side. 2. Raise and lower the head. 3. Raise the arm on the affected side over the head. 4. Flex and extend the elbow on the affected side. The correct answer is 3. A client who has undergone chest surgery should be taught to raise the arm on the affected side over the head to help prevent shoulder ankylosis. This exercise helps restore normal shoulder movement, prevents stiffening of the shoulder joint, and improves muscle tone and power. Turning from side to side, raising and lowering the head, and flexing and extending the elbow on the affected side do not exercise the shoulder joint. While assessing a thoracotomy incisional area from which a chest tube exits, the nurse feels a crackling sensation under the fingertips along the entire incision. Which of the following should be the nurse's first action? 1. Lower the head of the bed and call the physician. 2. Prepare an aspiration tray. 3. Mark the area with a skin pencil at the outer periphery of the crackling. 4. Turn off the suction of the chest drainage system. The correct answer is 3. This crackling sensation is subcutaneous emphysema. Subcutaneous emphysema is not an unusual finding and is not dangerous if confined, and the nurse should mark the area to detect if the area is expanding. Progression can be serious, especially if the neck is involved. A tracheotomy may be needed at that point. If emphysema progresses noticeably in 1 hour, the physician should be notified. Lowering the head of the bed will not arrest the progress or provide any further information. A tracheotomy tray would be useful if subcutaneous emphysema progresses to the neck. Subcutaneous emphysema may progress if the chest drainage system does not adequately remove air and fluid. Therefore, the system should not be turned off. After thoracotomy, the nurse instructs the client to perform deep breathing exercises. Which of the following is an expected outcome of these exercises? 1. Deep breathing elevates the diaphragm, which enlarges the thorax and increases the lung surface available for gas exchange. 2. Deep breathing increases blood flow to the lungs to allow them to recover from the trauma of surgery. 3. Deep breathing controls the rate of air flow to the remaining lobe so that it will not become hyperinflated. 4. Deep breathing expands the alveoli and increases the lung surface available for ventilation. The correct answer is 4. Deep breathing helps prevent microatelectasis and pneumonitis, and also helps force air and fluid out of the pleural space into the chest tubes. More than half of the ventilatory process is accomplished by the rise and fall of the diaphragm. The diaphragm is the major muscle of respiration. Deep breathing causes it to descend, not elevate, thereby increasing the ventilating surface. Deep breathing increases blood flow to the lungs. However, the primary reason for deep breathing is to expand alveoli and prevent atelectasis. The remaining lobe naturally hyperinflates to fill the space created by the resected lobe. This is an expected phenomenon. Which of the following areas is a priority to evaluate when completing discharge planning for a client who has had a lobectomy for treatment of lung cancer? 1. The support available to assist the client at home. 2. The distance the client lives from a hospital. 3. The client's ability to do home blood pressure monitoring. 4. The client's knowledge of the causes of lung cancer. The correct answer is 1. Because clients are discharged as soon as possible from the hospital, it is essential to evaluate the support they have to assist them with self-care at home. The distance the client lives from the hospital is not a critical factor in discharge planning. There are no data indicating that home blood pressure monitoring is needed. Knowledge of the causes of lung cancer, although important, is not the most essential area to evaluate given the client's postoperative status. The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought it on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be, 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. When developing a community-based service program for clients with chronic mental illnesses, which of the following is the least important? 1. Partial programs. 2. Psychiatric home care. 3. Residential services. 4. Long-term hospitals. The correct answer is 4. For a community-based program, the need for long-term hospitalization is least needed if the other services, such as partial programs, psychiatric home care, and residential services, are available and accessible. Which of the following clients has the least priority for admission to a psychiatric healthcare facility? A client with a 1. Potential for self-injury. 2. Potential for injury to others. 3. Grave disability. 4. Decline in functioning at work. The correct answer is 4. Although all of the options are commonly true, the primary reason for concern is that parents commonly provide financial support and housing for their chronically mentally ill children. The most critical needs after loss of the parents are the lack of financial support and housing, which are hard to replace. A 25-year-old client diagnosed with chronic schizophrenia states, "I stopped my medications a week ago. I was just tired of not being able to drink with my friends. Besides, I feel fine without them." Which of the following responses by the nurse is most appropriate? 1. It's important for you to go back on your medicines. 2. I hear how difficult it must be to live with the changes caused by your illness. 3. You will have to talk to your doctor about stopping your medications. 4. Your buddies will understand that you can't drink anymore. The correct answer is 2. By acknowledging the difficulties of living with the illness, the nurse conveys empathy for the client's feelings and opens up the lines of communication. Although it is important for the client to maintain compliance with medication therapy, telling the client that it is important to start taking them again or to talk with the doctor about stopping the medications ignores the underlying feelings of the client's initial statements. Stating that the client's buddies will understand may or may not be true. Additionally, this statement ignores the underlying feelings. A nurse is teaching the families of clients with chronic mental illnesses about causes of relapse and rehospitalization. What should the nurse include as the primary cause? 1. Loss of family support. 2. Non-compliance with medications. 3. Sudden changes in medications. 4. Non-attendance at treatment programs. The correct answer is 2. Non-compliance with medications is documented as the primary cause of relapse. Although loss of family support, sudden changes in medications, and non-attendance at treatment programs may contribute to relapse, these factors are not as significant as medication non-compliance as causes of relapse. The nurse is planning care for a group of clients who are chronically mentally ill. Which of the following strategies is likely to be the least beneficial for the client population? 1. Teaching independent living skills. 2. Assisting clients with living arrangements. 3. Helping clients in insight-oriented therapy. 4. Linking clients with community resources. The correct answer is 3. Insight-oriented therapy is less beneficial for this client population. The nurse's role in a psychosocial rehabilitation program involves teaching the client to live independently by using interpersonal skills and community resources.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.